Okay, my name is Don Bechler. I chair Single Payer Now in California. I got involved in this in 1993 when I worked in a big, I worked in a defense plant. 2,500 of the 4,000 workers got laid off when the Cold War was coming to an end, and people were panicked. A lot of middle-aged people just panicked about what they're going to do with their health care. And then I walked into we had an initiative in California in 1994. I want to talk about building our base of supporters and adding to our numbers. I think we're in this pickle we are right now because while we have an extremely powerful idea, as a movement, we're somewhat small. And so my thing, I'm like a broken record with people in the movement, is how big is your database and what is your plan to grow it? So let me ask a quick question. How many people here are in groups that have a database of more than 200? Raise your hand. Quite a few. How many people here are in a group that has a database of more than 1,000? Raise your hand. We lost some. How many people here are in a group that has a database of more than 5,000? Raise your hand. Okay, now we're down to about 8, 9, 10. Okay, how about 10,000? Still there. Good. Excellent. Okay, so, right. So, right, some of you I'm counting twice because you're in the same group. Okay, so, okay. But this past year, we started out thinking this is not going to be, healthcare is going to be in the news every day, but it's clearly Obama's on a course not to fight for single payer. And we've kind of predicted whatever comes out of the Congress is going to make, everyone's healthcare is going to get worse. We made sure part of our goal was to build our army in this process. So in the last 7 months, our database has gone from about 7,500 to we're 99 short of 13,000 people on our database. Okay. And to me, that's what, so the fundamental thing I want to talk about is building our databases. It's the only way to measure our successes. We can all go give talks all day long, but then how do you quantify your success? Okay, and databases are really important in our movement for 2 reasons. One, we just need to get out our message to people when things break. I do not trust the media. I'm not into a bunch of media stuff on this stuff. I think the media is fundamentally opposed to single-payer folks. I call it the wealthy media. We do get some media on occasion, that's good, but fundamentally they're opposed to this thing. The other thing, though, it grows your base of activists. So we're always asking people to do things. And one of the most fundamental tools we have to build our database is we have these little postcards. They're addressed to President Obama, and they say something like, you know, they're polite. Dear President Obama, please modify your health care proposal to remove the health insurance industry from our lives. And you can do this by supporting HR 676. And so we're always out on the streets getting people to sign these postcards. That's how we added nearly 6,000 people to our database in the last 6 months using these tools. And you know, we pass them along and to folks in Washington, D.C. to try to get them to Obama. But the whole process is building our database. And so for me, I hope everybody in this room, you know, starts plotting or has a plan how to build their database. So next year we can come back with the whole room raising their hand that they're in groups that have 10,000 people in their database. Because that's to me is how you measure your progress. We're in this pickle because I don't think our movement is big enough. We've seen the insurance industry this past year do some pretty good things, I mean, from their perspective against us, okay? I mean, they started this whole HCAN thing. There's part of that whole process. Some people call that, you know, they sold this whole concept of, I call it faith-based savings from public option. No evidence, it's all faith-based, based upon voodoo economics, but there's no evidence for it. But they did a good job of selling it. And it kind of because, thank you. And it's because people want to have something going, and they say, yes, and this will do it, but we all know it's nonsense. So anyway, the faith-based negotiation. So that's kind of the bad thing that's happened to us this past year. And the process of this thing, too, we've also, you know, a lot of us have less confidence in some of the co-sponsors of single-payer stuff because they voted on the wrong side of the question this past week. The good thing that's working for us is I think these are good times for single-payer activists. Because there's a lot of the Obama supporters now who are all part of this faith-based, you know, dazzlement, who are now wondering what the hell is going on. And in San Francisco, we would go to some of their boot camps. There'd be 300 people, and some of us would argue, you know, what's the proposal? You know, what's the proposal? Is it just do it now, or whatever Michael Whitey said? Yeah, you know, we need it now, or something. Anyway, so they tried running another boot camp this past Thursday in San Francisco. They didn't get their 300 people. They sent out announcements all over Northern California. They had 15 people show up. And we know their donations are down. This is a teaching moment for us to reach out to those people and to explain to them that, you know, they should have fought for what works, and they should have, as negotiators, walked into the room asking for something more than what they wanted, not setting the bar of what they were negotiating for so it's so low that you never get what you want. And they even got, you know, they're getting smashed. This is a very good moment for us now to pick up lots of people in our database by reaching out to all these people who have good hearts, but who we can go and talk to. I'll leave it there. Thank you.